Hi everyone, this is Dr. Akash Mangukia and I'm making this video from the hospital at night. Right now it is 1 a.m. and right now I'm doing the internship in this hospital. So I thought I should make a video because I haven't posted any kind of videos in past so many days. So in this video I'm going to solve some doubts of students who are going to prepare for the USMLE exam. Lots of students are asking me so many questions, but I cannot reply them all in the Instagram because my Instagram is deactivated right now. But a few days ago I opened my Instagram and there was so many messages of you guys. So let me clear some doubts of students who are asking me so many questions. So very common questions I get asked is, how should you prepare for your exam? So if you are a medical student right now, see, there is a requirement, okay? First and second year students, don't prepare right now because you are eligible for USMLE exams after only 2 years of your medical school. And about USMLE Step 1, and if you are really dedicated to do Step 1 in your third year, then you should start preparing from your second year because you have to have knowledge of anatomy, physiology and biochemistry must, because after only first year you can understand the concepts that is given in this first year, because right now also I'm reading the first aid. And second question that I get asked is, from where you start from first aid. If you are not understanding first aid, take BNB videos with the first aid, understand BNB videos, and after that try to understand the first aid, because BNB is explanation of first aid. If you are doing BNB, then you can do first aid so easily. So I will recommend you to do BNB videos first and then do the first aid, or do simultaneously. This is your main core book for your preparation, okay? Other than that, people are asking me when you should do your U-World. People are doing U-World first and then they are doing first aid, and they are not even seeing the first aid, they are doing just the U-World. See, if you are doing U-World, I know it is great source of USMLE Step 1, but you have to have knowledge of first aid first, because in Step 2 there will be 60% of first aid knowledge and 40% knowledge is from those subjects like surgery, OB-GYN and surgical subject from in Step 2. And Step 2 is not pass fail, remember that. People are just going over the first aid so quickly because first step is pass fail right now. They just want to pass. Believe me, this book will help you in Step 2 also. So prepare this book so nicely that you will get nice score in Step 2. Don't just read this book or do directly U-World for just passing the Step 1. Okay, this book is really necessary. So first do your first aid, then do U-World at the end, okay? And the third common question I get asked is pathways. I have made separate video about pathways, you can check that video out, but I'm gonna explain you briefly in this video that pathway 1, pathway 2, there is total 6 pathway, okay? So pathway is for certification, okay? So if you want to get certified by ECFMG, you have to fit in from one of those 6 pathway, okay? I'm gonna go for pathway 1. So I'm getting the license of India, and from pathway 1 I can apply for certification. Some people have done their MBBS outside of India, so they are maybe Philippines. So Philippines is accredited to WFME for until 2030. So those students can go for pathway 3 instead of going for pathway 1. But my university is not accredited to WFME right now, so I'm going for pathway 1. So it will not affect me after 2024 because my ECFMG registration is already done. And in ECFMG website there is mentioned that if your registration is done, if your notary is done before 2024, older rules will be applied to you, okay? So if you have not done your ECFMG registration yet, and if you are already in third or fourth year and you are planning for USMLE, try to do your ECFMG registration as soon as possible before December, because in 2024 it's all going to change and you will regret it later. So I recommend you to do ECFMG registration before December, and you have to fit in one of those 6 pathway, okay? First pathway says that you have to have license to practice in any country independently. So I'm gonna go from here. Right now I'm doing internship for that, and if I do internship I will get the license of India and I will go for pathway 1. There are few university is under pathway 2, pathway 4 and pathway 5, and there are many university under pathway 3, but I'm not sure which university are those because those are accredited with WFME. So make sure you are fit in one of those pathway. And pathway 6 is new pathway. In that, they will evaluate you by the board certified doctor in the US, and after that you can apply for pathway number 6. So that's it I want to say in this video. I thought I should make a quick video about this because I'm getting so many questions around this. If you are preparing, then best of luck, all the best to you guys, and stay safe. Bye bye.